The examination of the knees. The general principles of joint examination remain relevant for the knee examination. The knees and thighs should be exposed. Watch the patient walk and use the opportunity to look for difficulty or pain while walking. Note asymmetry or deformity involving the knees or thighs.
Hi Richard, what I'd like you to do is just walk for me towards the bed and I'll be just examining your walk. Okay, thanks, turn around. Wondering if you could actually sit on the, lie down on the bed. I'll just adjust the pillow here.
Look carefully at the quadriceps muscles for wasting, then at the knees themselves for skin changes, especially inflammation, and scars that might suggest injuries or previous surgery. Synovial swelling may be present on the medial side of the patella. Fixed flexion deformity is best seen by squatting down and looking for the space under the knees. Now ask the patient to flex and extend the knees one at a time.
Well, one leg at a time. I'd like you to bend your knee for me, please.
Normally the patella glides upwards as the knee extends. It should remain centered over the femoral condyles. Patellar subluxation causes it to slip laterally during flexion of the knee. Feel the bulk of the quadriceps muscles. Wasting occurs early after the onset of knee problems because of disuse. Palpate over the knees for warmth and synovial swelling. Test for a joint effusion. The patellar tap is used to confirm the presence of a large effusion. One hand rests over the lower part of the quadriceps muscle and compresses the suprapatellar bursa. The other hand pushes the patella downwards. The sign is positive if the patella is felt to sink and then comes to rest with a tap as it touches the underlying femur. The bulge sign is used to detect small effusions. Here the left hand compresses the suprapatellar pouch while the fingers of the right hand are run along the groove beside the patella on one side and then the other. Look for a bulge on the other side caused by a fluid wave. This is a sign of a small effusion. Now test passive flexion and extension. Rest one hand on the patella and feel for crepitus as the joint moves. Note the range of movement and any discomfort it provokes.
Just relax your leg for me, please. I'm just going to extend and flex your leg. Okay, thanks. And again, just relax there for me. Okay, thank you.
Feel gently for tenderness along the joint line at the patellar ligament and at the sites of attachment of the collateral ligaments.
Actually, to bend your knees here, like that. Thanks. Is there any tenderness there? Okay, this leg down. Okay, thank you.
Test the ligaments
Stay
next.
very relaxed.
The lateral and medial collateral ligaments are assessed with the knee slightly
I'm going to
flexed.
test for laxity in your knee.
Lateral and medial movements of the leg on the knee joint are tested. Movements of more than 5 to 10 degrees are abnormal.
Okay, thanks. Just relax your leg there.
The cruciate ligaments are tested next. The patient's knee is flexed to 90 degrees. The examiner's hand grasps the tibia and attempts anterior and posterior movements of the leg on the knee joint. Movement may be detected by the examiner's thumbs positioned at the joint margins. Again, movement of more than 5 to 10 degrees is considered abnormal. Increased anterior movement suggests anterior cruciate ligamentous laxity, and increased posterior movement suggests posterior cruciate ligamentous laxity.
All right, thank you.
If recurrent dislocation or subluxation of the patella is suspected, the patellar apprehension test should be performed. Push the patella firmly in a lateral direction while slowly flexing the knee. The patient's face should be studied for the anxious look that suggests impending dislocation. This is the moment to stop the test.
Okay, relax there. And relax this leg.
Ask the patient to roll into the prone position.
What I'd like you to do now is to roll over and lie on your belly, and I'm just going to adjust the bed down flat.
Okay.
Look and feel in the popliteal fossa for a Baker's cyst. This is best seen with the knee extended. This is also the position in which Apley's grinding test may be performed. This is a test of meniscal damage. The patient's leg is flexed to 90 degrees. The examiner stabilizes the thigh and while pressing on the foot, rotates the leg backwards and forwards. Pain or clicking make the test positive.
Relax there. Bring this leg up. And okay, good. Okay, thank you. Right, what I'd like you to do now, please, is to
Stand the
hop out of
patient up
bed.
again. Look
Just stand
particularly
up
for
and
varus
walk over
and
to the
valgus
chair and
deformity.
sit down for me.
Finish with a test of function. Get the patient to walk to and fro and to sit and stand from a chair.
Fold your arms, and now to stand up. That's good. And back down, please.